Well, we've got to squeeze this in. I know it's a snow day here, but what happened? The state of Pennsylvania revealed that health providers accidentally, is the word they were using, gave out thousands of the second dose Moderna vaccine as first doses. Now, so 100,000 Pennsylvanians could be affected by this. I know it's confusing, so we're going to get to this. The question on everybody's mind, I suppose, is how, well, more on my mind is not how it happened, what we're going to do about it. Hi, Barry. Barry Ciccocioppo. Did I get that right, Barry? Ciccocioppo.
Yes, you did.
Thanks for joining us.
You're the COVID-19 press secretary?
Yes.
I didn't even know we had that. When did you take that position?
Last month.
Last month. Okay, that's why I didn't know. Well, good to have you here. All right,
Thanks
real quickly, let's jump over how did it happen. More importantly, what are we going to do about it? How did it happen?
Basically, it was a perfect storm of confusion among some of the providers in the doses they were receiving, some miscommunication and miscues from the state. And we are working to fix both of those systems and improve our tracking of the vaccines that are going to providers.
Well, I heard that it was the mistake that might have been made back in early January. Is that accurate?
Well, it seemed to have started about 4 weeks ago. This weekend is when we discovered it, when providers requested more doses for second doses, more vaccine for second doses than we were allotted from the federal government in total. And that's when we started to look back and figure out what happened, and more importantly, how are we going to fix this?
So how do you fix it? How far does it set you back?
Well, it's going to take about 3 weeks. Over the next 3 weeks, we are going to get this fixed. And the main thing we need viewers to know is that if you got your first dose of vaccine, your second dose will be available for you at the very same provider. We may have to shift your appointment a week or two, which is completely within the CDC guidelines. You can get your second vaccine within 42 days. So we will stick to that. And over 3 weeks, we will correct the situation.
And it's important to know, because we have talked about the first dose versus the second dose. It's the same thing, isn't it? It's not like there's something different if you get the second dose before you get the first one?
It's the exact same medicine each time. And it doesn't matter to the individual. They just need to know, I got one, now I'm getting two.
Yeah, well, can it just be switched then, or is it
number
scheduled?
two, but pretend it's like it's number one.
It's the exact same thing. What we can do better is package it for the provider so that they know this box is for second doses, this box is for first doses, and that was not previously done.
True, but the person would know if they had the first one already, and couldn't you just go to a big box and there's a bunch of vaccine? What difference does it make if it's the first one or the second one? I've already had one. Can you give me the second one?
It doesn't matter to the individual. It matters to providers to be able to track the doses that they have so that they schedule new appointments only for first doses that they receive, and that they keep the box that will be marking for second doses when people come back.
You know, I'm very proud to live in Pennsylvania, and but I just saw something. Is it true? Have you heard this, Barry, that, or I should say, Secretary,
Barry's good,
that the life expectancy in the United States has gone down a year because of COVID? I could understand why there's so many of us dying.
A lot of stress too.
Yeah, it's like from 78 to 77 years now.
I have one more question about the mix-up that happened. Are folks supposed to wait to hear from you guys, or are they supposed to actively reach out and figure out when they're going to get their new date?
The provider where people receive their first vaccine the provider will reach out to people if they need to reschedule. Not everybody will need to be rescheduled, but for those that will need to be rescheduled, maybe out a week or two, the provider will reach out to them and they'll go back to the same provider.
So stay by the phone. We've been doing stories about the state of, when it comes to, Pennsylvania and how things have been going. And it's just interesting how we're ranked 46th among states in the number of shots administered per 100,000 people, and then 47th by percentage of allocated doses that have been given. What do you think the reason is that for Pennsylvania, we seem to be having some trouble getting this going?
Well, if you want to look at how Pennsylvania compares to the other states, let's look at the numbers from the CDC. Pennsylvania has delivered 1.9 million doses of vaccine, and West Virginia, often touted as a model for vaccine delivery, has delivered 396,000. So we've delivered 400% more vaccine than West Virginia. We've delivered more than New Jersey, more than Ohio, in terms of the number of doses going out.
So if that's the case, then why are people saying that we're ranked so low? Because we're seeing, those are a couple of states. We're seeing other states that seem to be doing this better.
Well, they're trying to compare percent of vaccine delivered per 100,000 people. But again, look at the numbers. Pennsylvania has delivered a phenomenal number of doses of vaccine to
So I guess it just
individuals
depends
here.
on where you live, because for some folks, if they're still in the situation,
And it depends
overall.
and it depends on what headline you believe.
That's true.
You know what I mean?
It's difficult to get the vaccine right now because we're only getting about 185,000 doses from the federal government this week. And we've got about 4 million people that are eligible now trying to chase those doses.
So do you, there was a report out yesterday that maybe the Biden administration believes that we can have 600 million doses out in America certainly by the end of the summer. Is that possible?
Pennsylvania's doing its part, I can tell you that.
Okay.
I'm sure it's no easy job.
Oh, well, good to meet you, Mr. Secretary. We'll have you back.
Thank you. Yeah, we'd love to talk to you more because folks have lots of questions. So we're welcome to come back anytime.
Thanks, Alex. I much appreciate it.
Of course.